One of the requirements for a successful LASIK surgery is to ensure perfect alignment of the corneal flap at the end of the procedure. In this video we would like to demonstrate an observational sign that ensures perfect alignment of the flap after repositioning without the need of steroid eye drops, which might carry the risk of migrating under the flap. This first video shows a series of LASIK cases where the flaps were created with the femtosecond laser demonstrating our alignment sign. Here we are pumping out the excess fluid underneath the flap with an applanating lens. A microsponge is then used to dry the gutter, and you can see that the area of dryness exceeds the area of direct touch. This area might even reach the whole circumference of the flap at the very first touch. This is explained by the microcapillary action in the very narrow space between the flap and the stromal bed. When this sign is visible, it ensures there are no kinks or gaps between the flap and the stromal bed. The flap is hence perfectly aligned. As a comparison, and probably due to the difference in architectural structure of the flaps created by microkeratomes, this sign is not possible to elicit. A microcapillary space cannot be created. In these cases with the microkeratome blade, the sign could not be elicited no matter how many times we tried. In this case, two eyes of the same patient, where one eye was done by the microkeratome and the other by the femtosecond laser, the sign of perfect alignment could only be elicited in this eye after the femtosecond laser cut. In this case, an enhancement treatment 8 years after previous microkeratome LASIK, we performed a ring-shaped side cut into the old interface with the femtosecond laser. The edges of the old flap are marked at the corneal periphery. After completing the treatment, the sign could not be elicited while drying the gutter as usual. Drying the other side only showed an incomplete sign. We suspected a less than perfect alignment, and after washing and realigning the flap, its position became much better. This time, the sign became positive all round, ensuring a perfect alignment of the flap. As a conclusion, this simple and non-invasive test is very helpful in ensuring perfect alignment after flap repositioning. It can only be elicited in flaps created using the femtosecond laser technology. Thank you for your attention.